I'm Wilbur Farrell. My wife is Margaret Farrell.
I've been Margaret's home health nurse off and on for about 4 years, 3 to 4 years. And basically with med teaching, she had congestive heart failure. She had high blood pressure.
Celeste suggested that she bring Janette over to discuss somebody to help me with Margaret, because it was going to get more difficult and was becoming more difficult.
So I just brought Janette, because we work together, same office, and I just brought her on a home health visit.
We're taught about the continuum of care, that we want to keep that with patients because it's better for them and better for the families. So I talk with the home health nurses regularly, or they come to me with the patient that they think may be a candidate for hospice. And with the family permission, I may go out and do a visit with the home health nurse just to introduce myself and let them know about the availability of hospice. It's to help the family for the last 3 to 6 months of their life. And it helps them to cope better, and it helps them to just live life better for them, and to know that there is help for them and they have someone that they can rely on. And it's not just for the final moments and days. Yes, it is for that as well, but you know, people get the most out of hospice when they have that extra time.
I wanted to keep everything familiar, and then I talked to Janette, and we decided that's the way we'd go. I didn't want Margaret to go. She wanted to be home, and I wanted whatever she wanted. That's the way I wanted. So Janette said, well, this could happen. The services could be here, which surprised me. I wasn't really aware of what you could have.
Same nurse, same aide, same everybody, and that's important.
Just like Celeste in home health, we do a lot of education, medication, talk about the disease process, the stages of dementia, what you can do if you want to be part of it, and what we can do if you don't want to be part of it. The services that we provide is such as the social worker, the chaplain, volunteer services if they needed it, and also I have an LPN that helps out as well. So, and it's mostly education and comfort and teaching them what to expect.
It was like a weight lifted off. I didn't have to be nervous. Somebody does it for you. It's taken care of. Wow, it's what a relief. And it's covered, which surprised me.
It's a Medicare benefit that you know, we provide a lot of services to them that they don't have to pay for. And during this time when you're losing a loved one, it's very difficult. And we help them, you know, spiritually, emotionally, financially. We help them with that. And it's a good option for a lot of people.
Janette would say, you know, we can take care of this, we can take care of this, and do this, and it just worked out beautifully. So it was like seamless, you know, just continued. And that made it almost, you know, what can I say, perfect. Almost perfect. Everybody was great. Janette was great. Celeste was great. And Ann was great. The last day, Ann said she's really, really close. She's breathing so slowly. And I'm not saying that that's going to be it, but she's really, really breathing slow. So she leaves, and sure enough, that night, you know, the early morning, that was it, you know. So yeah, they have you ready for it, you know. Very, very nice. Part
of every hospice is what we call a bereavement program, and we will stay in touch with the family for 13 months.
That's the first thing that Janette said. Well, I'll call you back. Said, it doesn't end here. Said, we'll stay in touch. And I thought that was really nice, because you could just say, well, okay, Margaret's passed on and she's gone, and so everybody's okay. But it's nice to know that somebody cares enough to say, well, how are you doing? I would do this all over again the same way.
To be able to take care of her towards the end was a joy, because the family was educated, she was comfortable, and you know, if we're doing that, we're doing our job, you know, and that's what it's all about.